So today was day 8 of transcranial magnetic stimulation therapy, or TMS, for depression and anxiety. For those of you who are new here, I'm trying to make a video journal every day that I'm undergoing treatment so that I can talk about how the treatment went, how it felt, and talk a little bit about my mood every day to see if I can keep track of any changes or improvements in my mood as we go along. That way I can actually tell if this treatment is working for me. So today they did again the bilateral stimulation with the really fast tapping on the on the left side for depression, and the slower tapping on the right side for anxiety. And I'm gonna post. Well, actually, I think I showed you guys at the beginning of the video what the slow tapping looked like, and how I tried to zoom in so that you can see that my eyebrow was twitching a little bit, but I'm not sure if you were able to see that in the video or not. It's just an odd sensation. As I mentioned previously, they slowly increase the increments of the like the intensity of the tapping, and they've been kind of slowly increasing it by 5% increments. And today I got up to 100 on the left side and 110 on the right side, and ultimately their goal is to get all the way to 120, so I'm almost there. They started me off really low, like about 30 or 40% as far as intensity, and they always check in with me periodically to make sure that the intensity is not, it's not painful and that it's still manageable. And they always ask me if how I'm feeling, and always remind me that I can let them know if I feel like the intensity or the tapping is too hard, and I can always ask them to take it down a notch. But so far, that hasn't been the case. I think I've been tolerating the treatment pretty well. I will say that the past sessions, it didn't feel painful, just an odd sensation and a little bit uncomfortable. But today, getting up to 100 and 110, I started to feel a little bit of the pain. I'd say on a scale from like 1 to 10, the pain was like maybe at a 3. So it wasn't unbearable or anything. Everyone's pain tolerance is different. So, you may experience less pain or no pain at all. I just want to be completely transparent with you guys and say that at about level 100, which I reached today, that's when I started feeling some slight pain, as opposed to just like uncomfortableness that I was feeling the past couple of days. But again, nothing too extreme. Still manageable, pretty tolerable. So it's nothing that I would say like, oh, I'm just gonna back out because it's starting to hurt a little bit. No, I mean, and if this is like almost as bad as it gets, because I'm almost at 100 and 110, I'm pretty sure I'll be able to tolerate 120, and that it won't be a problem once I get there. Um, so yeah, so let's see. Today I actually woke up feeling a little less anxious, and just a little better. I don't know how to explain it. Like just not as heavy emotionally uh, as I usually feel. Um, And I'm hesitant to say that this is because of the TMS treatment, because I feel like we're only getting started with week 2. So I feel like it's too soon to tell if the treatment is working for me. It might have been because, like I mentioned in the past 2 videos, I forgot to take my stimulant medication for ADHD for 2 days in a row because I lost my pill bottle. And this morning I took it, so it's hard to say whether the slight uplift and energy and how I'm feeling was because of the TMS or because I started taking my stimulant medication again. So again, I just wanted to mention that. And I wanted to mention that my ADHD medication that I take on a daily basis, it's the 26.1 milligrams of azstarys. It doesn't usually do much in terms of I think the anxiety, if anything, it heightens the anxiety. And as far as my depression, I wouldn't say that it's ever really done anything to stop the anxiety, the depression. Like, I have gone through episodes where I still take my stimulant medication on a daily basis and I still have really bad depressive episodes where I can't get out of bed. I would say more than anything, the stimulant medication just helps me um, focus a little bit more and just have a little more energy throughout the day. But I don't feel like it does much in terms of the depression and anxiety. So again, it's hard to say whether the slight improvement that I'm feeling is because of the TMS treatment or because of the azstarys medication that I started taking again. Um, yeah, so my depression levels, they always ask me to rate my depression and anxiety levels on a scale from 1 to 10. So today my depression was at a 5 and my anxiety was at a 7, which is like 1 point below what it normally is. Which isn't like a huge improvement, but it's something. Um, so again, treatment was tolerable, not painful. Today was a very stressful day at work for me because I had to finish assessing a child, which I talked a little bit about that whole process in the previous video. And I had to finish and like an IEP report, which takes forever. And then on top of that, I had to hand out like IEP paperwork to all the teachers who were going to have speech only kiddos in their classes uh, this year. So it was a lot of interaction, a lot of socializing, and that kind of stuff does tend to like drain me faster and wear me out because I'm very much introverted and very much, I also have social anxiety, so it can be tough. Um, and I was jumpy today. So again, somebody walked into the speech room to greet my speech, the other SLP, the supervisor, to say like, hello, welcome back. And I wasn't paying attention because I was so focused on trying to finish the report in front of me. And when he said hi, I jumped, and he just kind of giggled a little bit and just walked away. I guess because he wasn't expecting it, right? But I was like, oh, I was so focused on this report. I didn't. And sometimes that happens when I'm in. I think I tend to startle a lot more than normal people do, regardless. But I find it like when I'm intensely focused on something or something that I feel like I really need to get done, um, I tend to startle a lot more than when I'm not so focused. So today I saw, who did I see today? So far, the TMS technician, my SLP supervisor, which is the other speech therapist who works with me in the schools. Who else? The school psychologist, the student's mom that I'm assessing, and the student that I worked with. Who else? Like the receptionist at the school. I talked to a couple of the teachers. Um, and my dad, because he picked me up from work and took me to the TMS center. I saw my son in the morning before leaving for work, but I haven't seen him since I got home because he's out eating with my mom. And that's who I saw today. I talked a little bit about how I felt and what medication I took today. And as far as what I did, is just the usual work all day, then go straight to the TMS center. And then today, in about 20 minutes, I have class via Zoom from 6 to 8 because I'm working on my graduate class. And yeah, I will not be updating tomorrow because the TMS clinic is actually closed because they're doing, I don't know, some sort of maintenance or something. So I will be back on Monday for to report on day 9. Yeah.